So, everyone can have trouble remaining attentive from time to time. I'm sure each of us can attest to the fact that sometimes it is difficult to remain attentive to the task at hand. But for some, this problem can be both consistent and chronic. Perhaps the student simply can't ignore the dancing shadows that are being cast by the limbs of the tree that's being blown by the wind outside of the window of the classroom. Perhaps the student can't ignore the methodical sound of footsteps that are waxing and waning as other students pass by the classroom. Perhaps the student simply can't ignore the different thoughts and ideas being passed around in their head as the teacher continues to explain something that they lost track of 10 minutes ago. If this problem is severe, often there's issues at work, at home, and especially in the classroom. These are some staple characteristics of ADHD, which is a neurodevelopmental disorder that affects a large portion of children and young adults today. Today we'll be going over some key questions that we should know as an educator when preparing to create an inclusive and positive learning environment for students. Some of these questions include, what is ADHD? We'll talk about why this information matters to us as educators. And additionally, we'll discuss what it looks like in the classroom, some characteristics, and sort of just what it looks like in the classroom, what it manifests itself as in students in school. Additionally, we'll talk about how ADHD is both diagnosed and assessed, as well as possible instructional strategies that can be applied to aid students affected, as well as resources that are available for students and parents alike. And then hopefully, once these questions are answered, each of us will be more prepared to provide an inclusive and supportive classroom for our students. But before we get started, why is this important? Why should you all take the time to listen to what I have to say today? Well, everyone in this class is here in the hopes that they gain the knowledge that is required to become an educator. This means that one day each of us will be in our own classrooms with our own students. We will each be responsible for fostering academic success in each one of those students. And recent studies performed by the Center for Disease Control state that approximately 11% of school-aged children have been diagnosed with ADHD. That means that generally speaking, 1 out of every 10 students that walks through your doors into your classroom will be affected by ADHD. Additionally, it does not seem that this problem will be going away anytime soon, given that the number of diagnoses has risen every year since 2003. Subsequently, this is something that will affect each of us. It is important that we strive to be knowledgeable about these topics so that we can provide a positive learning environment for 10 out of every 10 students that walks through that door, rather than 9. So moving forward, what is ADHD? Well, ADHD stands for Attention Deficit Hyperactive Disorder, and as kind of already stated, ADHD is much more than a tendency to become distracted. ADHD is actually an impairment of the growth and development of the brain or central nervous system. This impairment often results in severe and pervasive symptoms of inattention, hyperactivity, and impulsivity. Additionally, according to Daly and Birchwood, students with ADHD often also exhibit deficits in certain prefrontal executive functions. This may include response inhibition, working memory, and other associated learning disorders regarding reading, spelling, writing, and arithmetic as well. In fact, ADHD often occurs in tandem with other disorders and conditions. Study performed by the CDC found that in 2016, among U.S. children between the ages of 2 and 17, nearly 2/3 of children with current ADHD had at least one other mental, emotional, or behavioral disorder. As we're talking today, we're mainly going to be just focused solely on ADHD, but I think it's something that one should keep in mind when discussing the disorder, that it often does not occur solely by itself. And as a result of these symptoms, performing in an academic setting may prove very difficult for the children affected by the disorder. So how exactly is ADHD diagnosed and assessed? The first step in the process is referral, because simply in order for an issue to be elaborated on, it must first be brought to light. Parents and teachers are often the first to notice emerging or existing symptoms simply because they're around the students a lot, and symptoms often begin when a child is young. Symptoms show early, therefore parents and of course teachers are often ones to first notice these symptoms. And then once these symptoms are noticed, a more formal analysis can be considered, and in most cases, the evaluation is fairly comprehensive. Practitioners make sure to take home life, academics, as well as social functioning into consideration. According to Chad, assessment may include parent and child interviews in which they just sort of discuss possible symptoms that may have arisen or shown in a student's past or a child's past. Um, they often have students and parents and sometimes even teachers or other people in close relation to the child complete a series of questionnaires, which sort of dive into the same questions that kind of talk about student behavior and their tendencies and things of that nature that might point towards a possible diagnosis. Direct behavioral observation is also sometimes used, as well as clinic-based psychology testing and individually administered intelligence testing. From there, these results are then reviewed and assessed by a practitioner, and a diagnosis is then given accordingly. So, considering the symptoms and how it's diagnosed, what exactly does ADHD look like in the classroom? What are some common characteristics, and what do those characteristics have to do with their performance? First things first, there's no really one size fits all set of characteristics. Each diagnosed student may experience the disorder to a different severity and in different ways. Regardless, some of the characteristics do remain common. Provided by CHAD, some of these characteristics, CHAD, the National Resource on ADHD, which is funded by the CDC. Some of these may include difficulty paying attention and appearing not to listen, and of course this is a result of uh, just rather inattentiveness, and with a wandering mind, a student may become off task and therefore be appearing not to listen. They often struggle to follow directions, again often because they don't receive the directions well because of the tendency to lose focus and not keep their attention on the task at hand. Students with ADHD often lose things, they're often forgetful. Additionally, they avoid tasks that require sustained cognitive activity. They are also often seen interrupting, excessive talking. A lot of the children move around a lot, simply due to restlessness and things of that nature. And as a result of these symptoms, children with ADHD are more likely to have poorer grades, lower scores on standardized tests, and a greater likelihood of identification for special education. So, with all of this in mind, the question remains, what can be done in the classroom to contribute to the success of students with ADHD? One option involves instructional and task modification, which simply means that an instructor will change or alter tasks or their method of instruction to better cater to the needs of the individual students. There's many ways that this can be done, one of which involves breaking down longer tasks into more manageable sections. And this basically just caters to the attention span of the student. Generally speaking, a lot of children with ADHD have shorter attention spans. It's harder for them to focus on cognitive activities for longer periods of time. So if a longer assignment can be divided into shorter subunits, they're more likely to be less intimidated. The task will be less daunting if it can be divided into smaller portions so that during their work time they can sustain their mental energy and sustain a high standard of work throughout their period of active learning or active task completion. Additionally, short assignments in general can be provided. This is often used for assignments that are mainly based on practice. Once a concept has been already learned and understood and mastered, when it comes to practicing it or drilling, some of the practice can be cut short so that, as stated, students can maintain their full attention during the times that they are working, and so that they don't burn out quickly and give up on the assignment. Additionally, frequent breaks is always a good idea. This is kind of the same general concept as dividing a assignment into subunits, but providing a student with frequent breaks allows them to burn off any excess energy and to rid themselves of restlessness that they might be feeling so that they can fully focus on the task at hand. Additionally, it's important to praise students upon completion. Simple positive reinforcement can go a long ways to maintain positive behavior. Additionally, as best practice suggests, explicit instruction is always recommended, which essentially is just using concrete examples, providing students with different modalities of instruction. Perhaps they learn best visually or in a tactile nature or in an auditory sense, but providing them with multiple different ways to understand the topic, they are more likely to receive the information well. Another option is possibly using choice-based assignments, which essentially just means all the children have a common goal, but they are provided different routes in which they are allowed to get to that goal. For example, the learning objective might be that children are able to successfully use adjectives within their writing. And then perhaps you offer them a couple choices to be able to exhibit the fact that they have the skills to do so. Maybe you offer them a worksheet that they can fill out if they prefer that, or you give them the chance to write a story in which they incorporate the use of adjectives, or maybe they start a journal about their day. By providing students choice, it offers them to personalize and get more involved within the assignment. Something that is more personalized in nature allows them to get more engaged. Students are often much more engaged and much more likely to stay on task and sustain their mental effort when it is something that personally interests them. Another option is peer and parent tutoring, which essentially is just one-on-one instruction that, like stated before, is better able to cater to a student's individual needs and accommodate to their learning style. It helps promote their strengths and resolve their weaknesses. Additionally, one-on-one tutoring or instruction helps eliminate some of the distraction that is often riddled within the general education classroom. With 30 students in a class and 45 minutes to get information across, there's bound to be distraction and commotion. And so one-on-one instruction can provide a more quiet and ideal setting for a student to really get down and focus on what they have to do. In a way, that's just another method of instructional modification. Regardless, it would be performed by either a peer or, as stated, a parent. It is shown that this may prove to be a very useful tool. Daly and Birchwood have found that peer tutoring improves classroom behavior and academic performance. In fact, those of whom who were tutored by parents using one-on-one instruction saw significant improvements in reading performance. Another option to consider is computer-aided instruction. Lowe and Feldman explain that it has an intuitive appeal for children with ADHD because of its interactive format, its use of sensory modalities, and its ability to provide specific instructional objectives with immediate feedback. So sometimes at, since students with ADHD often become bored easily and sometimes find some things to be rather mundane, by maybe transforming perhaps a math assignment into a game that's on the computer, it'll be more interactive, it'll be more stimulating, and therefore it may have the chance of holding their attention longer while they also have the chance to learn and really take in the information. Lastly, one might consider creating a token reward system, which is considered a consequence-based strategy. It's based on contingent positive reinforcement. Essentially, students are simply rewarded for good behavior, which reinforces such behavior. Maybe they're rewarded with tokens in which they can redeem for prizes. Maybe it's snacks. Regardless of what it is, it can go a long ways in reinforcing positive behavior. Additionally, oftentimes it is coupled with response cost intervention, which essentially just means that when they exhibit undesirable behavior, their rewards or their tokens can be revoked. And so while rewarding the student reinforces good behavior, the response cost intervention helps eliminate the bad behavior. Um, it, a few things to consider when implementing a token reward system is consistency. Um, Children with ADHD often experience difficulties demonstrating consistent behavior under conditions of partial or intermittent reward reinforcement schedules, and that was stated by DuPaul. Um, and basically, that just means the children should be able to anticipate what actions will result in a reward. If you're inconsistent, for example, if a student hands in an assignment on time one day and they get rewarded, but they hand it in on time the next day and they don't get rewarded, they may be much less likely to maintain that behavior consistently. Additionally, one needs to consider what constitutes a reward, so they can stay consistent in terms of that as well. Consistency is key, so that students know what to expect and they can cater their behavior accordingly. This has shown to be quite effective. DuPaul states that the combination of strategies has resulted in significant improvements in task-related attention, productivity, as well as accuracy. Finally, we have resources and support systems. So kind of the number one thing that any educator, parents, or student can do is to be informed about the disorder and about the things available to them to aid them, to help them along their way. One of the things that I found as a possible resource is the CHAD Annual Conference. And this is a yearly meeting that basically just breaks down the key elements of the disorder and how those of whom are affected by it can handle it and positively deal with their situation. Additionally, CHAD also has online communities, which are essentially forums where people who are affected by the disorder or parents of children who are affected by the disorder can participate in an online forum. They can ask questions, they can talk about stories that they have in common and kind of resolve things together as individuals who all come together with the same common situation. Additionally, George J. DuPaul, Lisa Wayand, I apologize for the mispronunciation of any names, as well as Grace Janesis, wrote an article entitled ADHD in the Classroom, Effective Intervention Strategies. And this article has seemed to be a staple of many of the resources that I have discovered on the topic. They all seem to cite this article, and it has an abundance of accurate and very thorough information, which can significantly help educators who are looking to learn more about ADHD and what can be done in the classroom to help those of whom are affected by it. So in terms of support systems, in order to have access to them, the students need to be firstly identified. The disorder and it has to be brought to light in order for accommodations to be applied. Some of these accommodations may be extra time to work on an assignment. Students may be allowed to access a separate room or a quiet area to take tests or do assignments. Possibly students may be able to record the lecture that is done by the teacher so that they can refer back to it in terms of instructions or information. Students may be offered frequent breaks, as stated before, to really burn off any restlessness or extra energy. Additionally, parents should establish a route of communication, whether it be email or daily report cards or things of that nature, to stay informed about their students or about their children and their performance, and stay involved in their lives. So, in conclusion, ADHD is something that we as educators are bound to encounter within our careers. And therefore, it is important to be educated and to understand the key aspects, which are, what is ADHD? Why does it matter? How is it diagnosed and assessed? What it looks like, the characteristics within the classroom, possible instructional strategies to aid students, as well as resources and supports available to students and parents alike. It's important that we know and understand these aspects so that we, as educators, are able to provide an adequate, positive, and inclusive learning environment for each and every student that comes into our class.